Pregnancy. It is an absolutely incredible 9-month journey, just full of milestones and changes and, let's be honest, a lot of questions. So, in this explainer, we're going to walk through that whole journey together, breaking it all down into a nice, clear, simple roadmap. So, whether you've just seen that little positive test or you're just starting to think about it, you know having a sense of the path ahead can make all the difference. Think of this as your personal guide to all the key moments and check-ins you can expect over the next 9 months. Okay, so it all kicks off with that very first prenatal visit. This appointment is so foundational because it's where you and your doctor set the baseline for a healthy pregnancy. Now, during this visit, and really throughout the whole journey, you're going to hear some specific medical terms. So let's just quickly clear up a couple of the most common ones right now. You'll probably hear the words gravity and parity thrown around, and they sound kind of technical, but it's really simple. Gravity is just the total number of times you've been pregnant. Parity is the number of times you've delivered a baby after 20 weeks. So, see, one tracks the pregnancies and the other tracks the deliveries. That's it. What's really so interesting about this first visit is just how much vital info they gather right away. A dating ultrasound gives you the most accurate due date possible by measuring the baby from head to bottom. Yep, that's the crown rump length. And at the same time, they'll do a bunch of blood tests to check on everything from your blood count to your immunity against certain viruses. It's all about ensuring the safest possible start for both you and your baby. All right, so with that foundation set, the journey really settles into a rhythm of regular check-ins and some major milestones. These are all designed to track how the baby's developing and, of course, to monitor your health through each trimester. Let's take a quick look at the timeline. This timeline here shows you all the key checkpoints of a typical pregnancy. So after that first visit, you've got the quad screen, which looks for certain chromosomal conditions. Then comes the big one around 20 weeks, the anatomy scan. That's a super detailed look at your baby's development. A little later, a glucose test screens for gestational diabetes. And then finally, the GBS swab gets you ready for a safe delivery. So why are all these tests so important? Well, the quad screen gives you valuable early information. The anatomy scan is that really reassuring head-to-toe checkup for the baby. The glucose test is great because it catches a common pregnancy-related condition early on. And the GBS swab just makes sure a simple precaution can be taken to protect your baby during birth. See, every test is a proactive step towards a healthy outcome. Of course, pregnancy isn't always a perfectly smooth ride, but the good news is regular monitoring means that most of the common issues are found and managed really easily. It's all about being proactive with care, not just reacting when problems pop up. A perfect example of this is anemia. During pregnancy, your blood plasma volume increases dramatically. We're talking up to 50%. This basically dilutes your red blood cells, which can lead to